What question does self-care really answer? So on one side we have the environment, on the other side we have the body. Over years, generations, even ages, our bodies have been adapting to our environment. So we get adaptation, whether for good or whether for bad. Self-care searches both sides of this equation to find out where a healthy life balance is, and in that way, restoring health. My name is Noel Miller, owner of Design Fitness, expert in self-care, and specialist in exercise prescription. And I want us to explore the world of self-care together. I think I'd like to go over the two perspectives of exercise prescription versus self-care. Now, if we take a look at stretching, for example, from an exercise standpoint, we're thinking that stretching is great to kind of be flexible, be a little bit more movable. However, from a self-care standpoint, which is a little bit more long-term or kind of big picture, if you will, we're looking to see that with the increased flexibility, our muscles are able to communicate proprioceptively with the rest of our body for a long period of time. So what this means is in older age, you'll have more information going to the muscle, therefore it'll be easier for you to move around freely without having the kind of fear of falling. If we take a look at the exercise style of it, we want to work out from an exercise prescription to be stronger, be faster. However, from a self-care perspective, we're looking to exercise the muscles to increase muscle quality, the overall ability for the muscle to do what it does every day, and in that way give us more adaptability when we decide to do anything. Our body's ready to take on the information and the challenge of any activity that we go about because the quality of the muscle is great. This has a lot to do with the various factors: stretching, proprioception, flexibility, a little bit of strength for sure, endurance more often, and making sure those postural muscles are really working well so that we don't have compensation in the body. Now, when we take a look at an injury, when you get hurt, exercise prescription, the idea is to make sure the muscle can regain its ability to have the proper range of motion, the ability to move how it did before. Self-care is a very similar approach. We want to make sure the muscle can do all the things that it was able to do before. However, we're also trying to get rid of the fear around being injured in that exact same area. There's a kind of tense body posture that happens because you did feel pain when you got injured. We need to release that. If we don't, then that kind of guarded posture will create a change in mechanics that's not going to be positive in the long run.